specific day, I had 3 spine cases and 1 cranial case. My day starts at 7:30 a.m. My first case was a patient who presented with a symptomatic synovial cyst. A synovial cyst is a cyst that starts in the facet joint, which is the joints in the lower back. These cysts oftentimes grow towards the nerve, causing nerve compression. So this patient underwent an L3-4 fusion along with decompression. This case takes about 90 minutes or so to do. We finished the case around 9 a.m. Around 9:30 a.m., our second case started. This is a patient who presented with isthmic spondylolisthesis. Isthmic spondylolisthesis just means a case of spondylolisthesis or shifting in the vertebrae, as you can see in the MRI, as a result of damage or lack of development of the pars interarticularis. And a lot of times this can lead to back pain. It can also result in instability and at times nerve compression too from arthritis or ligamentous hypertrophy that can happen as a result. To treat this, we did a 2-level fusion, L4-5 and L5-S1. This case took about 2.5 hours. The third case that we had was a patient who presented with adjacent level disease, arthritis that develops above a prior spinal fusion. In this specific case, the patient underwent a previous fusion about 4 years earlier, did extremely well, and then began complaining of some claudication or leg pain, and an MRI revealed stenosis or narrowing above the prior fusion. This case took about an hour and a half to do. Around 2 o'clock, we started our last case, which is a cranial case of the meningioma. This is a patient who presented with severe headaches. MRI scan showed evidence of this enhancing mass, as you can see on the MRI, involving the left side of the brain. This case took about 2.5 hours to do. Specifically, we did a craniotomy. Postoperative MRI, as you can see in the picture, shows good resection. Over the course of time, the brain will re-expand and occupy that cavity again.